With 40 years in nursing, I'm blown away. To me, informed consent, I thought, was a basic, foundational, secure piece of the healthcare system that we weren't allowed to mess with. For 40 years, I'm not allowed to touch people, hardly. I'm not allowed to put something on someone's body or in somebody's body without them understanding it and choosing to accept it, unless the person doesn't have capacity to do so, and then there's a process we go through with that. Information is required. When you look at the definition of informed consent, coercion is not allowed. People are not allowed to be punished for the choices that they make with healthcare. There's not supposed to be negative repercussions for their choices. We had nurses giving vaccinations to nurses who were crying because the nurses knew enough to know that we didn't know enough about these vaccines. You couldn't get an exemption for love nor money in this province. I only know of one individual who got an exemption, and that was after their first vaccination, after they regained consciousness several days later. We heard doctors telling their patients, I don't think this vaccine is a good idea for you, but I'm not allowed to give you an exemption. Doctors were prevented from practicing medicine and providing appropriate care for individuals according to their individual situation. Yesterday, I learned that 114 Nova Scotians died from COVID, I think in the first 2 years. I'm not positive, but I'm pretty sure that I could find you 114 people who either died or aren't sure how they're going to live because of vaccine injuries. Some of those people chose, but some of those people didn't feel they had a choice. It wasn't informed consent. I'd like to talk about the appropriate technique for intramuscular injections. I teach this stuff, and I teach to aspirate. So normally, when we're giving somebody an intramuscular injection, so if we're using the deltoid, we have to make sure there's enough muscle there that we can actually get into a muscle. We're not going to hit bone. And so we bunch up, we landmark to find bone and the right place to inject. And then when we quickly inject the needle, we hold it steady and we pull the plunger back just a little bit, create a little negative pressure to see if a little blood comes back into the syringe. If blood comes in the syringe, that means I'm not in muscle, I'm in a blood vessel. I have to pull the needle out, put pressure there so they don't get a bruise and whatnot, throw that out, and then I have to draw up and landmark and inject in a different site. Bear with me. I live and breathe my standards of practice and my code of ethics. Nursing is hard, but I love it. It's important work and I've been proud to do it. Nurses are supposed to be critical thinkers. We're supposed to have awesome knowledge, skill, and judgment. We're not allowed to just follow orders. Leadership is expected and required of us. It says so in our standards of practice, which are legislated documents, and our code of ethics. So legislated, to me, I understand that means it's law. This is what we're supposed to do. We're supposed to also work within our scope of practice, which means as a registered nurse, I'm only allowed to do what I have the knowledge, skill, ability, and judgment to safely, ethically, compassionately do for an individual or group. Yes, most people are familiar with nurses caring for sick people and people who are injured and people who are dying, but we also are required to do health promotion and disease prevention as well. I expected public health education to not be just stay home and wait for your vaccine and wear a mask when you go out and have distance. I expected we would also encourage people to support their immune system, to let people know the best way to fight off a virus is to have a healthy immune system. Fear does not make your immune system stronger. It makes it weaker.